Hi, this is Dr. Rosenberger with Appalachian Spring Dermatology, and today we're talking about laser procedures that we do here in the office. This video is about laser hair removal or laser hair reduction. For laser hair removal in the office, we use a 1064 in the YAG laser. This is particularly important in this case for laser hair removal, that the 1064 actually is the one that goes the deepest in the skin compared to all other lasers. So a laser that doesn't have a highest number or isn't a 1064 Nd:YAG might not reach the deepest root of the hair. So that's why we like to use this one. The other reason why we like to use a 1064 Nd:YAG is that the peak of the energy occurs deep in the skin. Because it's occurring deep in the skin, there's less risk of injuring the outer layer of the skin. When you're using a laser to treat hair, you're using it to target the pigment in the hair. So if the skin is very dark on the surface, particularly those with darker skin types, then there can be some confusion for the laser between the darkness of the skin and the darkness of the hair. With a 1064 Nd:YAG, we can use it on the darkest of skin because the peak of the laser energy occurs deep in the skin, so there's very little risk of injuring or discoloring the outer layer of the skin. Some other layers with other lasers that have a shorter wavelength of light, but their peak of energy higher and therefore can damage the outer layer of the skin. So that's why we picked this one. Laser hair removal, usually we do a series of treatments. When we first started doing this, we've been doing laser hair treatments since 2005 in the office. When we first started, we would do them every 6 weeks, but generally people do not need them that close together. So a lot of times we'll do one treatment, have them do the second one at 6 to 8 weeks, and then we recommend waiting until there's a significant amount of hair grown back before you do subsequent treatments. So the third one might be 3 to 4 months, the fourth one might be 4 to 6 months. A lot of times they can be spaced out a good bit. You can do them more frequently, but if there's not hair there, you're sort of wasting money. So the most frugal way of doing it is waiting until there's a significant amount of hair there and then doing the laser treatment. We generally recommend or tell people that it may take up to 6 treatments to treat all the hair in a given area. That's because the laser only targets the actively growing hair. So at any point in time, some of your hairs are actively growing, some are resting, and some are falling out. So the laser only targets the actively growing hairs that are anchored to the root of the hair follicle. So if the hair isn't anchored to the hair follicle, then it won't cause the necessary damage to the hair follicle. What happens with the laser is the laser targets the pigment in the hair, heats up that hair. The heat is, which I like to describe as heat, but it's energy, is transferred then to the hair follicle and then causes death to the hair follicle. So only those that are actively growing and well anchored will respond to the laser. So that's why we have to do a series of treatments. And the other big thing is the thicker, the darker the hair is, the better. Again, because we're using the pigment in the hair as the target. So knowing all those things, let's get started. So I've already applied to her skin some aloe vera gel. We use clear aloe vera gel in a number of our laser treatments, both to help transmit the cold temperature from the laser handpiece and to help the laser glide a little bit better. So in this laser, the handpiece is, the tip is gold plated and has water circulating through there. So it's actually very cool on the skin. I usually demonstrate that to patients. So when we go over the skin, we're going to move the laser in this direction so that we're chilling the skin first and then lasering. The laser will actually come through where the red beam is. And if I notice somebody flinch or something is painful, a lot of times I'll go back and re-chill that area to make it feel better for them. Depending on the size of the area that we're treating, sometimes we'll do spot by spot, and sometimes we'll just keep gliding through the area. The laser will treat all the hairs within that spot on a single pulse. So depending if there are 10 hairs there, it might hurt a lot more than if there's 1. This is not the most pleasant thing to have done, to be honest, but almost everybody who I've ever done it on says when they come back, wow, that was worth it. So we'll get started here. You saw that little flinch there. That's pretty normal. It doesn't, like I said, it's not the most, we're doing it for real. We're not goofing off here today. And she doesn't have very many hairs here on the lower part of her chin. A lot of times if somebody doesn't have a lot of hairs, I'll still glide through that area just so that if there are any, you get them. We'll go ahead and treat this side of the chin, and then we'll come back and treat her lip on another day. The areas that we do treat with laser hair removal in the office are most commonly the chin, lip. Some people have us do the beard area. For men who tend to have some straight hairs on their cheeks and other places, sometimes we'll sculpt a nice little beard for them so that they don't have to shave outside of the area where they want their normal beard hair to be. I've done ears, and then on the body sometimes we'll do the chest, the back, the legs, underarm, bikini, all of those areas. Areas are priced differently based on the size of the area that we're treating. If you would like to come in for a consultation, we can go over pricing and all those things a little bit more with you. Thank you and have a great day.
Call for an appointment today and learn more by going to our website at wvderm.com.